So I have a lot of people who tell me that they like to sleep with the television on. And let me tell you a couple of different reasons why this is problematic. So first and foremost, when you're trying to fall asleep with the television on, the television is going to be emitting blue light. And this is something that I think we hear about a lot, but we don't really know what that means, why blue light is bad. So let me tell you, blue light that comes from televisions, from screens, from laptops, all of those different devices, that blue light is the same wavelength as sunlight. So that's really important for us to know when we are getting ready to wind down for bed. The brain should not be exposed to sunlight. So think about our caveman ancestors. How did they know when it was time to be awake? Well, the sun rose. How did they know when it was time to go to bed? The sun went down. So we now, in this modern age that we are in, we have so much technology. We have the ability to have lights on and screens going anytime that we want to. Think about going into a casino. It's very hard to tell what time of day it is in there because of the lights and the noise and everything that's going on. And we have the ability to, with all of our technological advances, not actually know what time of day it truly is. So that's very confusing for the brain. So as we're getting closer to bedtime, we no longer rely on the sun setting for our body to know when it's time to go to bed. Now, we still have this built-in biological clock, also known as the circadian rhythm, and that is very strong. That is one way that our body tells us that it's time to go to bed, but we do a lot of things to kind of get in our own way. And one of the things that we do to get in our own way is being exposed to blue light. And particularly in this video, we're talking about televisions. So if you are sleeping or you're trying to rest in your bed and you've got the television on, that blue light is coming into your eyes. So we're gonna get a little sciencey here for a second. It's coming into the retinas, going back to the suprachiasmatic nucleus, going back to the pineal gland. The pineal gland is where melatonin is released. And when we have blue light coming into our eyes, same wavelength as sunlight, then the brain is getting confused and it's saying, oh no, turn off the melatonin, suppress the melatonin. We don't need this anymore because sunlight is coming into the eyes. And that is telling me that I need to be awake and I need to be alert. So with that being said, that's one of the reasons why I don't recommend people sleeping with the television on. Another piece of the TV, whether you've seen this episode or this movie many times before, which is something that people often tell me, is that they have kind of a comfort show or comfort movie. It's something that they've seen many times. Unfortunately, the brain is still very interested in watching this. It's interested in the characters, it's interested in the storyline. And when we do things that are interesting to the brain releases dopamine. Dopamine is a naturally occurring hormone that our body makes, and dopamine is something that is it gets us to continue doing more of whatever that activity is if the brain likes it. So it is very reward based. So, oh, I like doing this. I like watching TV. The dopamine says, let's keep watching more TV. So that's one of the pieces of dopamine. And it's also, whenever we are thinking about various different activities, dopamine is going to be the activity that we are very interested in doing. So sleep, while it has many, many benefits, and you're going to learn more about that as you keep watching my channel, but sleep right here, right now, in the present moment, doesn't have a whole lot of enticement for the brain and the body. Instead, it would be rather watching television or playing games on a phone or something like that that's in dopamine inducing and very interesting for the brain to play with and to enjoy. So that's another reason. Now, one of the biggest reasons, and I think this is kind of like the kicker for most people, when it comes to the brain, think about it. Its job is to interpret language. That's what it does. It's constantly taking information in all day, every day through our ears, and it's interpreting language and it's determining what is important. Are these things that I need to be acting on? So whenever it comes to trying to fall asleep with the television on, the brain is not going to be getting into those deep stages of restorative sleep. Keep watching my channel. We're going to talk about deep sleep, light sleep, and REM sleep and why all of them are important. But one of the things that you need to know is if we are watching television and the brain is busy listening and interpreting to that language, it's not going to get down into those deep restorative stages of sleep because it's busy thinking that it's still supposed to be doing its job. So when we give our brain the opportunity to rest by turning off the television, then we can get into those deep restorative stages of sleep and the brain can actually do what it's supposed to be doing all night long. Another thing, whenever it comes to having the television on, unless you're wearing a really thick eye mask or a sleeping mask, there's a lot of light and movement and colors that are coming through on the screen. Think about your eyelids. Your eyelids are actually very, very thin and transparent. I know that might sound a little bit gross, but it's true. Unless you have a very thick eye mask on, your eyelids, a lot of that light, a lot of that color, a lot of that movement is going to be coming through the eyelid. And when that happens, that has the potential to cause microarousals. That is a very fancy word. All that means is very small awakenings, so small that you may not even realize that you have been awakened. However, it is disruptive to the body, to the brain, to the sleep cycles. So that's another thing that's really important. Another thing that I want you to take into consideration is oftentimes the television program volume is like this, but then the commercials are like this, and it's just a little bit distracting. So whenever we have changes in volume like that too, that can be very distressing for the brain. Again, we can end up with more microarousals. So these are just a few reasons why it's not a great idea to sleep with the television on. I know that there are a lot of you out there who are going to tell me that you have slept with the television on since you were a child. This is something that doesn't bother you. If that is you, I challenge you to try to make some changes. I know that this may be a very big change that I'm asking you to make. But one of the things that you can do is try setting a timer on your TV. Most TVs have something like that, and you can decide usually like 10, 15, 20 minutes. And just start to, especially if you're someone who sleeps with the television on all night long, see what would happen if you set your sleep timer for 20 minutes for a week or so. Then see what would happen if you set the sleep TV timer for 15 minutes for a week or so. And then getting down to 10 minutes, 5 minutes, and then seeing if we can fall asleep without the TV on. And this may feel like quite a big change for you, but I think doing it in those baby steps is going to be a really good idea to get you to where you want to be. Again, sometimes we don't know the difference between what a really, really good night's sleep is and what a decent night's sleep is, because maybe we've only been having a decent night's sleep for quite a while now, and we're not really sure of what the full potential and the full capabilities are. So I challenge you to do that. And if you are someone who really wants to take a challenge to the next level, my best recommendation for you is remove the TV from your bedroom altogether. Then we don't have any confusion as to what is supposed to be happening in the bedroom. Again, we're going to have more videos on this, so keep an eye out about all the things that should be happening in the bedroom and all the things that we need to be removing from the bedroom. So if you're ready to take this challenge to the ultimate level, I encourage you to remove your TV completely from your bedroom. So let's recap. Whenever it comes to sleeping with the television on in your bedroom, blue light. We talked about blue light having the same wavelength as sunlight. That's problematic because it's going to tell the brain that it's time to be alert and awake rather than it's time to be sleepy and to calm down and to get into this state that is conducive to rest. The next piece of it is dopamine. The brain is interested in the characters and the storyline, and it wants to keep watching, so it's releasing dopamine so that you will keep watching. Also, too, with that, remember the brain is wired to interpret language. So it wants to listen, it wants to hear, it wants to interpret what's going on and see if there are any messages or anything that it needs to act on. And because of that, we're not getting into those very deep stages of sleep that we need to be. Again, remember there's all that light coming in from the screen. So the light, the movement, the colors, all of that are going to be coming into the eyelids, again, unless you're wearing a sleep mask, which again, even if you are wearing a sleep mask, I still highly encourage you to remove the television from your bedroom. But those, remember, your eyelid is very thin, and so you are going to be potentially causing micro awakenings. Remember, the commercials are super loud and really obnoxious, so that's just going to be one more way to have micro awakenings throughout the night. So again, if you have the ability, I highly encourage you to do a sleep timer on your TV for shorter and shorter and shorter periods of time until you get to the point where you can fall asleep without the TV on. And again, if you want to take it to the very highest level of sleep maximizing, is to remove the television from your bedroom altogether. My name's Dr. Leah Kaler, and thanks for joining me on this sleep tip.